Every year, millions of seniors, perhaps even you, line up for countless medical tests. You believe you're protecting your health, diligently undergoing blood tests, scans, X-rays, and heart monitors, all in the name of staying safe and healthy. But what if I told you that some of those very tests, the ones you trust, might actually harm you? What if some of the routine checkups your doctor orders could quietly push you toward unnecessary treatment or even lead to surgery, stroke, or cancer? It sounds shocking, doesn't it? It's a difficult truth, but science is increasingly clear. A significant percentage, up to 37% of medical tests in seniors, lead to treatments or procedures that ultimately do more harm than good. And here's another surprising fact. Almost 99% of people over 70 have no idea they're being over-tested. They trust the system, not knowing the hidden risks lurking in what seems like routine care. Consider this. One of the checkups we'll discuss today, number 1 on our list, is now linked to 5% of all cancer cases in the US. That's a risk comparable to drinking alcohol every single day. You won't find this information on clinic walls or in hospital brochures, but the truth is out there, buried in the data. And today, we're bringing it to light for you. So, stay tuned as we reveal the 5 health checkups you should seriously consider avoiding after 70 and explore the safer, smarter choices you can make instead to truly protect your well-being. Before we dive in, we'd love to hear from you in the comments below. Where are you watching from? How old are you? And have you ever regretted a medical test or procedure? We read and reply to every comment with personalized advice. If you care about your health and your freedom, please don't forget to like this video and subscribe to HappyGrandpa 69, where wisdom and wellness go hand in hand. Now, let's start with a test that looks harmless, but could quietly steal your peace of mind. Checkup number 5. The bone density scan, also known as a DEXA scan. It sounds innocent enough, right? No needles, no pain, just a quick scan to check your bone strength and ensure you're not at risk. But here's the catch. After age 70, this test often creates more fear than it provides actual benefit. You see, a DEXA scan measures bone density to detect osteoporosis. But at this age, some bone loss is perfectly natural. It's just like getting wrinkles or grey hair, a normal part of aging. Almost every scan in older adults will show a bit of thinning, even when there's no real danger or immediate threat to your health. Yet, many seniors are pushed to start strong medications called bisphosphonates. While they sound like a solution, these drugs can cause serious side effects, ranging from severe heartburn to the alarming condition of jawbone decay. Here's the truth. Treating mild bone loss with medication barely changes your fracture risk. According to a major US study, it offers just a 0.3% improvement over 5 years. But those side effects? They can last a lifetime, impacting your quality of life. Take Rose, for example, a vibrant 76-year-old retired piano teacher. Her DEXA scan showed mild bone thinning, so she was prescribed strong medication. Within 3 months, she developed acid reflux and jaw pain, so severe she couldn't even play her beloved piano. When her new doctor stopped the pills and switched her to a regimen of vitamin D, resistance exercises, and a calcium-rich diet, her strength and her beautiful smile came back. she regained her passion and her peace of mind. The takeaway here is crucial. If you're over 70, active, and haven't had fractures or falls, focus on lifestyle, not medication. Embrace calcium-rich foods, move your body regularly, and get plenty of sunlight. You'll build stronger bones naturally without the need for prescriptions or the risks of side effects. It's about empowering your body's natural resilience. Checkup number 4, brain MRI for mild memory loss. You forget names sometimes, you misplace your glasses, and naturally you worry. Is it dementia? So your doctor orders a brain MRI. Sounds perfectly reasonable, right? But here's the problem. Most MRIs in seniors show abnormalities that are actually just normal aging. We're talking about tiny white spots, small amounts of brain shrinkage, harmless signs of time passing, not disease. In one major study, a staggering 86% of seniors had abnormal MRI results, yet only 3% had anything truly treatable. The rest? They were scared for no reason, pushed into a cycle of anxiety. Many went through more scans, spinal taps, even surgeries. All unnecessary procedures that carried their own risks and emotional toll without providing any real benefit. Consider George, a 74-year-old retired engineer. He worried about his memory and got an MRI showing white spots. Terrified, he stopped driving and isolated himself, fearing the worst. But after proper comprehensive testing, his memory was found to be perfectly normal. His brain changes were simply signs of healthy aging, not a disease that required drastic changes or fear. Instead of an MRI, start with a simple memory test, the kind your doctor can do on paper. It's cheap, safe, and surprisingly accurate. And remember, forgetfulness isn't always a disease. Sometimes it's just fatigue, stress, or even dehydration. Addressing these simple factors can often make a world of difference without the need for invasive, anxiety-inducing tests. Checkup number 3, the cardiac stress test. The treadmill test. You've probably seen it or even done it. They put you on a treadmill, attach heart monitors, and watch how your heart reacts under exertion. It sounds like smart prevention, a proactive step to ensure your heart is healthy. But after 70, it's often a trap, leading to more questions than answers and unnecessary interventions. Here's why. Stress tests in older adults can give false alarms up to 40% of the time. That means the test says your heart is in danger, indicating a problem when, in reality, there isn't one. Those false alarms often lead to unnecessary invasive procedures like angiograms or even the placement of stents, which carry serious risks, bleeding, kidney injury, and complications from contrast dye. Take Raymond, a 75-year-old retired postman. He walked every day, felt perfectly fine, but took a stress test just to be safe. The result was unclear, causing concern among doctors. So doctors placed a stent, and Raymond ended up in the hospital with kidney damage. His fatigue, which was the initial concern, wasn't his heart at all. It was simply mild dehydration. All that risk for a simple fix. If you have no symptoms, no chest pain, no breathlessness, no fainting, it's often wiser to skip the stress test. A simple resting EKG or a calcium scan is safer, cheaper, and can often tell you all you need to know without the added risks. Checkup number 2, colonoscopy. Now this one might surprise you, as for decades, colonoscopies were considered absolutely essential for everyone. But after age 70, and especially after 75, the risks start to outweigh the benefits. Consider the process. The bowel prep causes dehydration and dizziness, which can be particularly challenging for seniors. The sedation can affect your memory and heart rhythm, posing additional risks. And the procedure itself, while generally safe, can cause serious complications like bleeding or, in rare cases, bowel tears, leading to emergency situations. A large study involving 1.3 million seniors found that for every 1,000 colonoscopies performed after age 75, only 2 lives were saved. However, a significant 20 people suffered serious complications. The risk-benefit ratio shifts dramatically. Consider Dana, a healthy 73-year-old grandmother. She had no symptoms, no family history of colon cancer, yet her doctor insisted on a colonoscopy. It found one tiny, benign polyp. But that very night, Dana was rushed to the ER with a bowel tear. She spent 9 days in recovery, lost 10 pounds, and endured immense suffering, all for a test she likely didn't need. The truth? Most people over 70 who've had normal colonoscopy results in the past don't need another one. Instead, ask for a FET test, a simple, non-invasive stool test you can do comfortably at home. There's no prep, no sedation, no hospital stay. It's a much gentler and often equally effective way to screen for colon health, especially for those without high risk factors. And now, the most dangerous checkup of all, the full-body CT scan. It's often sold as part of premium health packages, promising to catch cancer early and give you peace of mind. But what it really gives you is radiation. A lot of it. One full-body CT scan exposes you to the same amount of radiation as approximately 500 chest X-rays. That's a significant dose. According to major studies, CT scans now contribute to up to 5% of all cancers in the US. That's a risk comparable to daily alcohol consumption, a fact many are unaware of. The scan also often finds harmless things, little nodules, spots, or cysts that mean absolutely nothing. But once they're seen, the medical system often takes over, leading to more scans, more biopsies, and more fear. Marcus, an 80-year-old, took one of these elite health scans. They found a tiny lung nodule, which was harmless. But he didn't know that. He was immediately sent for more tests, resulting in a collapsed lung. Marcus spent 2 months in recovery, enduring immense pain and anxiety. The final result? The nodule was benign. All that suffering, all that risk, for absolutely nothing. Experts are clear. Never undergo a full-body CT scan unless you have real, specific symptoms that warrant it. If you feel well, trust your body's signals and its incredible ability to heal. Stay active, eat well, sleep deeply, and only test when there's a clear medical reason, not just for peace of mind from an unproven screening method. So there you have it, 5 common checkups that may look safe and routine, but can quietly harm you after 70. Medicine is powerful and offers incredible benefits, but it's not perfect. Sometimes, less testing truly means more living. It means fewer false alarms, fewer unnecessary procedures, and more time enjoying your life, free from medical anxiety. Before you agree to any scan or procedure, Empower yourself by asking one simple yet crucial question. What happens next if this test finds something? What are the potential consequences and follow-up steps? If the answer is unclear, or if the potential next steps sound risky or invasive for a finding that might be benign, pause. Because the best prevention isn't rooted in fear. It's rooted in wisdom, knowledge, and informed choices. Now tell us in the comments, have you or someone you love ever had a medical test that caused more harm than help? We'd truly love to hear your story and learn from your experiences. If you found this video eye-opening and empowering, please like, share, and subscribe to Happy Grandpa 69, where we are dedicated to helping you stay sharp, safe, and healthy at any age. Because growing older shouldn't mean more tests and more worries. It should mean more peace, more freedom, and more joy in living your best life. Thank you for watching.